I'm Don Finn. I am the editor of the COABE Journal, and I'm so pleased that you've joined us for this author interview. Today, we have two authors of an article called Braiding Together Family Literacy and Health Literacy, Insights into New Program Development. We are pleased to have Bree and Wendy with us, who co-authored this article for our Family Literacy special edition of the COABE Journal. So welcome to both of you. Bree, would you mind introducing yourself to our readers?
Hi, my name is Bree Straayer. I am the former Family Literacy Director at the Literacy Center West Michigan. Currently, I am an assistant professor at Michigan State University in their Department of Writing, Rhetoric, and Cultures, and I look forward to talking with you today.
And Wendy?
Great to be highlighted here and with this great article. I'm Wendy Falb. I'm the executive director at the Literacy Center West Michigan. I've been at the Literacy Center 10 years now, and one of the things that drew me to the job was actually family literacy. I was coming as president of the Board of Ed at Grand Rapids Public Schools and was absolutely intrigued by the idea of a two-generational approach to literacy.
Well, excellent. Thanks so much for introducing yourselves. And so let's talk a little bit about your article. Bree, let me start with you. So we always ask the question, why did you want to write this article for the COABE Journal?
From the launch of our project, working on health literacy and family literacy together, I knew that we were going to want to write about this. It was a really unique opportunity to bring that family literacy model into the medical establishment. We also were working with some really wonderful funders who were wanting to be engaged in a really sustainable community-based practice of building this program. So it was an exciting opportunity to try out some things, and I knew that we would want to share them with other practitioners out there. So when we saw the special issue for family literacy with COABE, we knew that was the place we wanted to write this up for and tell a little bit of the story of our process of building this new program.
Great. Thank you for sharing that. And really, your article is very interesting, where it shows how the family literacy program and understanding the healthcare system and so on is really been beneficial for those in your program. So let me ask the second question. How will adult education practitioners benefit from reading your article, and how will that benefit their learners?
So I think one of the key pieces in this article is the importance of co-design and deep listening in developing the project. At the Literacy Center, we're always challenging ourselves to design from a participant standpoint, but also from a collaboration standpoint. I think really good adult education is continuing to be responsive to today's needs of our learners, as well as design very dynamic collaborations with other organizations, because adult literacy doesn't happen in a vacuum. It happens in adult life, which happens in healthcare and at work and everywhere else. So I think that the big take, what I really would love for practitioners to recognize some of that work of collaboration and deep listening, but also be inspired to perhaps step up to it in a fresh way.
You know, one of the themes that we hear a lot about in our COABE journal, regardless of the topic of the edition, is the value of that collaboration and really how it benefits adult learners. So I think that's it really stands out in your piece, which is excellent. And so let me move on with another question, somewhat related, but what do you hope the readers take away from this article?
My hope that the readers will take away from the article is honestly a sense of possibility, and the sense of possibility of what can happen when we collaborate, when we go out into the community. I also am a firm believer in learning from others' successes and mistakes. And so we really tried to be as upfront as possible with what went well and what maybe we learned from. So sharing that, in some ways, I almost view writing the article as a form of collaboration in itself. We look at kind of across all of these other practitioners that we're all collaborating in this together. So I'm hoping that other practitioners will just take away that there are new opportunities out there, there's new ideas, and new ways to reach learners out in the community.
Yes, definitely. And I think that reaching the learners and having new topics or having various topic areas for them to learn and to benefit as they grow is just really outstanding, and it really stands out in this work. So let me ask you the final kind of catch-all question. Do you have any additional comments that you would like to share about your article and maybe about the lessons that you've learned through developing the program or anything? Wendy?
Well, one of the things Bree and I reflected on in the process of writing the article, but also being practitioners with adult education, we both have this training in academics. So we're trained to be able to write journal articles like this. But we see academics often being very divorced from the actual work that's happening in the ground. But conversely, we were also, especially Bree, I would have to say Bree and her team, and the director that followed on her, you get deep in the weeds of the hard work, and it's often very messy work. It often feels like it's not necessarily succeeding on the level that you envisioned. But when Bree and I took the time to step back, use all our skills as academics to reflect on it and write an article and reflect on the research that informed it and the other practice that informed it, we realized how much we had gotten done, how much we learned, and how much we were eager to share and build on it. And we were sort of reflecting on the fact that that space doesn't happen very often, that academics are disconnected, as I said, and we practitioners are just way too busy to reflect on it. So really grateful for a journal like COABE that's trying to bring those two worlds together, and grateful for the opportunity to work with an amazing academic like Bree, both as a practitioner and as a writer. So it's been a wonderful experience.
I would add to that too, Don. It was really interesting in writing the article. And just watching the program develop over those first 2 to 3 years. The family literacy model, we often talk about that the schools really help impact the families. They they bring community, they get involved at the schools. And what we found in working in medical establishment is that the learners and the people that we're working with have a lot to bring to the medical establishment. That there's this sense of community that as we listen to medical practitioners, that they're really finding lacking at these clinics. They aren't connected always in the ways that they hope they would be with the communities around them. And we found in working with there that so many people did not view medical places as places of community. They didn't feel they could go there without an appointment or or even just be in the waiting room. So as we've been working on this program, we've found that there's really something that bringing adult learners into these medical communities, that they're really influencing the medical communities and can maybe even bring in some of that feedback and some of that connection that those medical establishments are really hoping for. So that was an exciting realization to come to see really the ways that we can all help each other and all grow together, and really see what we can bring to the medical community, and not just what they can help bring to our learners, but that both give and take there together.
Excellent.
It
Yeah.
was, yeah. Thank you.
Excellent observations, really, from both of you. And I think the impact that our learners can have, oftentimes we look at the impact we have on them, but yet the learners have quite a bit of impact on programs and have quite a bit of impact on policies and the understanding of those who are in those leadership roles. But also, to your point, Wendy, the idea of bringing research to practice and having a venue to discuss how research principles and how these concepts actually work in practice is critical. And that's what I really appreciate about your article. And that's what we try to do here at the COABE Journal. So again, the title of the article is Braiding Together Family Literacy and Health Literacy, Insights into New Program Development. And you can read this article in the Family Literacy edition of the COABE Journal. It's available at the COABE website. you can just go to coabe.org and click on the journal tab, and you'll have all the information to access the article and to access the full edition. So thanks again to both of you, and thank you to our viewers for tuning in. Until next time, take care.